Hey there. Ever pictured yourself in a busy doctor's surgery, not as a patient, but as that super organized doctor's surgery assistant everyone relies on?
That's us, gearing you up to nail that interview. And we're not talking about handing you a scalpel and hoping for the best.
Definitely not. We're going all in career guides, nailing those interview questions, even how AI can give you an edge.
Exactly. Think of us as your personal interview prep team, even if your filing system is more creative than organized right now.
You get me. All right, let's prep for this surgery. First things first. What's the day-to-day like for a doctor's surgery assistant? What does our career guide say?
Picture this. The surgery door opens, a patient walks in, and boom, you're the first friendly face they see.
You're like the welcome committee.
More than that, you're the calming presence, the information hub, and the organizational master. All in one. Juggling appointments, handling the unexpected emergency.
A constantly moving puzzle, making sure everything fits just right.
Exactly. And then you're shifting gears, prepping for procedures, assisting the doctor, maybe even handling diagnostic tests. And of course, hygiene is key. Sterilization is the backbone of a safe surgical environment.
So you're the glue, the backbone, the organization guru. And knowing those everyday tasks sets us up for tackling these interview questions, right?
Absolutely.
Speaking of, let's dive into the first one. How did you become interested in the role of doctor's surgery assistant? Sounds simple, but I bet there's more to it.
You're right. This is your chance to showcase some real passion. Don't underestimate using those real-world situations we just talked about.
So not just saying, well, I needed a job.
Probably not the best start. Instead, imagine this. I was drawn to this role because I thrive in a fast-paced environment, making a real difference in people's lives. Being a doctor's right hand, ensuring a smooth and efficient practice, providing compassionate care, that's what excites me.
Wow, now that's an answer. Shows you've actually thought about the role. You've even woven in key responsibilities from the career guide. Now, let's say the interviewer throws you a curveball. How do you prioritize tasks when you have multiple things demanding your attention? Talk about real life.
That's them seeing how you stay organized under pressure.
Imagine this. The phone's ringing, a patient's in the waiting room looking a bit uneasy, and the doctor needs a critical patient file, like yesterday. What do? This feels like a job for the STAR method.
Absolutely. It helps structure your answer in a clear, concise way, highlighting your skills and experience.
Okay, so using STAR, I'd set the situation. Just the other day, I was prepping for a procedure while also managing appointments. See, multitasking already. Then task, the phone rings. It's a patient with an urgent question about their procedure. Knowing they might be anxious, I quickly assess the situation.
You're showing those key prioritization skills already. Now bring it home with your action and result.
Right, so I'd say, I politely put the caller in a brief hold, recognizing the patient in front of me needed immediate attention. I reassured the waiting patient and gathered the information they needed, which helped calm their anxiety. Then I returned to the call, apologized for the delay, and provided the caller with their information. By calmly assessing the urgency, I addressed both situations, ensuring a positive outcome for everyone. How'd I do? Did I pass the STAR test?
With flying colors. You nailed the situation, the tasks, and most importantly, showed your ability to think on your feet. That's a winning formula.
Phew. That felt good. Almost as good as a perfectly organized surgical tray. But we're just getting started. There are more interview hurdles ahead, and we're not leaving you hanging.
Ready for the next one? How do you handle difficult or upset patients?
Yeah.
Let's face it, even in the best surgery, emotions run high.
That's putting it mildly, right? You're dealing with people who might be in pain, worried, maybe even just having a bad day. Takes a special kind of person.
You got it. This question is all about your empathy, staying professional, and diffusing those tense situations. It's not just what you say, but how you say it.
So no getting defensive, no arguing, just pure compassionate communication.
Exactly. Let's say a patient's upset about a scheduling mix-up. Instead of, well, it's not my fault, try, I understand this is frustrating.
Okay.
Let me see what I can do to fix this quickly for you.
Nice. You're acknowledging their feelings, not brushing them off, offering a solution. Okay, next question, and this one's big. How do you ensure patient confidentiality is maintained at all times? We're talking serious stuff here, not just gossiping.
Absolutely. This is sensitive medical information. They want to know you understand that responsibility, that you know the data protection rules.
Okay, but how do you convey all that without sounding like a legal textbook?
Find that balance between knowledge and genuine understanding. Maybe a personal touch. Like, I treat every patient's information carefully and respectfully, just as I'd want mine handled. I'm also careful about data protection laws, making sure records are secure and confidential.
That makes sense. It's about genuine care. And speaking of care, next question. How do you ensure a safe and hygienic environment for everyone?
This is more than just saying, I'm a clean person.
There's those protocols, right? You're not
Mhm.
just wiping surfaces. You're using the right disinfectant, the specific sterilization for instruments, a hygiene superhero.
Exactly. Showcasing that is key. You could say, a sterile environment isn't just about cleanliness, it's about protecting everyone's health. I'm careful with hand washing, sterilization techniques, and making sure all surfaces are disinfected properly.
And those color-coded sterilization logs. Okay, this one's tricky. How do you handle a situation where a patient is dissatisfied with the service? Talk about a tough spot.
It's all about those conflict resolution skills we talked about. Staying calm, listening, finding a solution that works.
Sometimes being a detective too, right?
Yeah,
Figuring out what went wrong, how to prevent it next time.
exactly. Say a patient's unhappy with a long wait. Instead of getting defensive, try this. I understand that waiting is frustrating. I apologize for the inconvenience. To prevent this next time, could you tell me more about what happened today?
You're acknowledging, validating, and opening the door for a productive chat. Okay, let's keep going. How do you stay organized and manage your time in such a fast-paced environment? This role isn't for the easily flustered.
Show off your inner organizational guru. Remember those day-in-the-life scenarios. Connect those to your own organizational style.
So time for to-do list fanatics to shine.
Exactly. Get specific. I believe in to-do lists, prioritizing by urgency, but I also know flexibility is key in surgery, and I'm always ready to adapt when things come up.
Having a system but being adaptable. Got it. Especially with how unpredictable healthcare can be. Speaking of unpredictable, how do you ensure medical equipment is properly sterilized and maintained? Seems obvious, but what are they really getting at?
They want to know you understand that meticulous attention to detail when it comes to infection control.
So more than just, I'll follow the rules.
Way more specifics. They want to know you understand the different sterilization methods, keeping records, being proactive. You could say, I'm meticulous about sterilization protocols, autoclaving, chemical disinfectants, the approved methods. I also keep detailed logs and check equipment regularly to make sure everything's working perfectly.
Details, details, details. Last interview question, and a real thinker. How do you handle a situation where a patient's medical history is unclear or incomplete? This feels like a potential minefield.
It can be, but it's less about knowing everything and more about your problem solving, knowing when to get help.
So what's the best approach?
Honesty and thoroughness. You could say, if I'm missing information, I'd explain to the patient that I need a bit more to ensure they get the best care. I'd ask some clarifying questions, and if needed, I'd check with the doctor or a senior staff member to make absolutely sure we're not missing anything.
I might not know everything, but I'll find out, and I'll ask for help when I need it.
Exactly. We've covered a lot, dissecting interview questions like pros. But before we wrap up, let's talk about a secret weapon for interview success. AI.
RoleCatcher. Like having a personal interview coach in your pocket?
Yeah.
How does it work?
Imagine this. You're prepping, feeling a little unsure about your answers. RoleCatcher lets you practice, and its AI analyzes your delivery, language, everything, giving you feedback and suggestions.
A feedback fairy, but with algorithms.
Mm,
Amazing. And for crafting the perfect CV. Right.
exactly. You mentioned tailoring your CV. RoleCatcher takes the guesswork out. It analyzes the job posting, finds the keywords, the skills, and helps you create a CV that highlights what matters most.
Game changer, especially now. Okay, so we've got our answers. Our CV is sharp. What's next?
Think long-term. Landing the job is great, but knowing where you can go career-wise helps you set goals.
Career mapping. So where does a doctor's surgery assistant go from here? What does our career guide tell us?
It's not always linear, but you might go from entry-level to senior roles, more responsibility training, managing schedules, maybe even specializing in a certain area.
Wow, I didn't realize there were so many options.
There are, and that's why understanding the bigger picture is so important.
It's not just about getting the job, it's about building the career you want. Love it. So we've prepped, explored career paths, even got AI on our side. What more could you ask for?
One more thing is crucial for this role.
Don't leave us in suspense. What's that crucial ingredient?
A thirst for knowledge. Medicine's always changing, right? New tech, procedures, always something new. You've got to be a lifelong learner to thrive as a doctor surgery assistant.
It's not just about what you know now, but always adapting, always learning something new.
You got it. Every opportunity to learn workshops, shadowing pros, staying current with journals, make it part of your routine.
Like leveling up in a video game. But instead of slaying virtual dragons, you're gaining skills that can really help people.
Exactly. And who knows? That drive to learn might even lead you down a new career path. So many possibilities in the surgical world.
I love that. So if anyone's feeling a little overwhelmed by this whole doctor's surgery assistant thing, remember, you've got this. We've gone through what it's really like day to day, tackled those interview questions, even showed you the power of AI with RoleCatcher.
You've got the knowledge, the strategies, and the tools to succeed.
Absolutely. Now go out there, ace that interview, and embrace the world of surgical assisting. Until next time, remember, preparation is your best medicine.